You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with sleep apnea, and especially for those people that cannot tolerate or can't use their CPAP machine to go to sleep. According to my first guest, about approximately 60% of the people that get a CPAP that is known to be very effective for sleep apnea, they can't wear it. So it doesn't work. So now with these new custom-made dental appliances, people are back to sleep. They're not waking up, 10, 20, 30 times an hour. And the results he's getting, he says, are amazing. With us, we have an expert on this topic. We're also talking about chronic snoring. He said before we came on that helping the people with the loud snoring, those are the easiest. With us, we have Dr. Shah. Dr. Shah, welcome to the program.
Thank you, thank you.
For people that don't know your practice, I guess this is all you do. You don't do regular dental procedures. You just deal with sleep.
That's correct.
Is that right?
That's correct.
So who's coming in for this? Who's a typical patient?
Well, Randy, a lot of people believe that, we probably treat mostly oversized, overweight men. But in reality, our patient base is roughly 50% men, 50% women, and some who are overweight, but a lot of average weight, normal weight patients. So those who are fatigued, who are tired, they want to live, have a better quality life. They want to have more energy. They want to feel like they're alive. A lot of them are referred by their physicians because they've been diagnosed with sleep apnea, meaning they actually stop breathing. Sometimes, 5, 15, 30 times every hour during the night. And so they're just not getting enough oxygen. Some of them may be snoring excessively. They're having trouble sleeping with their bed partner, or they're having trouble going on trips with friends and family because they can't stay in the same, hotel room because they make so much noise when they sleep. So we see a wide range of patients with any of these conditions.
Now, we should mention, now, medical insurance covers this procedure, is that right?
Yeah.
And even Medicare, you take Medicare.
That's correct, we take Medicare
that's set
as well.
up for this.
Yeah. And we take most medical insurances, actually. I think that's one of the really unique aspects of this treatment, as well as of my practice, is that we accept medical insurances. And it's really not easy, Randy. I've been doing this for about 6 or 7 years now, full-time, just exclusively treating sleep apnea and snoring. And we're still struggling with insurance companies, but guess what? We've got a lot of them that we're contracted with, that have asked us to contract with them. And so it becomes a lot easier for people to get the care that they need so they can sleep better and live better and not snore as well. So.
Now, we talked at the, off camera at the break that many offices, dental offices that are doing this, are collecting the money in advance from out of pocket with the patients because they're not set up for medical insurance like you are.
Correct.
Because it may take 6 months or 12 months to even get paid.
Absolutely right.
So you're set up for that.
We're absolutely set up for that. And the important thing that I wanted to emphasize in my practice was that I didn't want to hold off on anybody's care because of what the insurance might dictate. Okay, so what we do is we check everything up front. We check all the benefits. We give the patient an estimate of what their coverage will be, but then we start them on the treatment, right? So that way they can get the care they receive. They can see a benefit right away. It can change their life, give them more energy. They can sleep better. They can function better, right? And then we'll take care of the insurance part as we go through the treatment, and it works out great.
Okay, so these people, just so I understand this correctly, they think they're sleeping, right?
Yeah.
Maybe they're told by their partner that they're loud, they're snoring or gagging or whatever, but they're not really sleeping.
Correct. Yeah, it's really
So help me understand that part.
Yeah, it's really the quality of sleep, right? So let me tell you this: if you're sleeping at night, you might not even wake up in the middle of the night if you're not breathing. Okay, it's just that your body though is coming out of deeper stages of sleep. And so it's called arousals. You're having these arousals when you're sleeping, but you're not fully awakening. So when you have these arousals, you're actually not getting the deep sleep that you should be getting to really refresh yourself, replenish your body, rejuvenate.
So how many times do they wake up?
Well, it can go as up to 30, 40, 50 times an hour, even more. We've treated patients that wake up almost 100 times every hour throughout the night, 8 hours throughout the night. Can you believe that? And they're exhausted. I had one patient, a female. She was approximately 50 years old. She was waking up 96 times every hour, okay, throughout the night. She could not tolerate the CPAP machine. Randy. So it was really detrimental to her well-being as well as her health as well. Well, her doctor finally gave in and referred her to our office for an oral device, and it changed her life. We were able to take her from not breathing 100 times, almost 100 times an hour, all the way down to about 3 times an hour, Randy. Now, 5 and below is actually considered normal, okay? So 5 and above is actually when you get diagnosed with sleep apnea. So we brought her from extremely severe sleep apnea, her oxygen levels dropping throughout the night, to only stopping breathing about 3 times. So it was fantastic. It changed her life. If you actually talk to her today, her facial expression, Randy, is completely different.
So they wake up tired.
Yeah, absolutely. Now, in her case specifically, she was waking up exhausted. She didn't have the energy to even go on walks, for example. She had a garden, which she was very proud of, but she wasn't able to maintain it, to the extent that she'd like to. And now all of a sudden, her fatigue is gone. She has more energy. She's waking up refreshed. She wants to go into the garden in the morning. She's telling me all these stories when she's coming in for her follow-up appointments, by the way. So she's able to garden. She's able to go on a walk. She's able to take her dog on a walk, and she's able to spend the time with her husband, and give him the attention I think that she's wanted to give him for such a long time. So their relationship is also really blossoming, and it's interesting because you think they've been married, for such a long time, for 30, 40 years, whatever it was, but it's like their relationship has just been transformed again, and so really an amazing story, and somebody I was very, very happy to that we could help out.
I mean, it's hard to believe that they really don't even know they have it, that a good majority of people. Yeah. Is that right?
That's absolutely right, Randy. So, it's interesting because people believe that they need to feel tired, or they believe that they need to snore in order to be diagnosed with something or to have a problem. But then they go in for these sleep studies, okay? They're not tired, they don't snore, and then they find out that they stop breathing 30 times an hour, okay? Making them having severe sleep apnea. By the way, then they start seeing the effects of that later on in their life, right? So you stop breathing 30 times an hour, at some point it's going to catch up to you. Your body's going to really feel that impact, right? So your body's in stress throughout the night, you're not getting the oxygen, your cells aren't getting the oxygen that they need. You start getting high blood pressure, you start having acid reflux, you start having difficulty losing weight, okay? It can lead to so many things. Increase your chance of stroke, Randy, by almost 70%.
So when you don't sleep, you're stressed, your body's stressed.
Absolutely.
So like these stress hormones.
Yeah,
I mean, look, everybody knows what it feels like to not sleep.
Yeah.
You're exhausted the next day, right? You're even kind of moody, right? You're overeating foods you normally wouldn't have.
Absolutely.
Is this the kind of thing that these people with sleep apnea are dealing with?
Yeah, people feel lousy when they don't sleep, and some of them don't realize that that's not normal because they've been dealing with this for their entire life. So it's not actually until they get the treatment that they realize, oh my gosh, this is who I am as a person. This is what I'm supposed to feel like. This is how I'm supposed to live my life. They can go to work and function normally. They can be happy and play with their kids, or they can go on walks with their spouse, And so it's really a transformation, not only physically, Randy, but mentally as well. Their outlook on life is different. They're more positive. Sleep apnea and depression also have a huge correlation. If you're not getting the quality of sleep, and I'm going to really emphasize this because it's really quality over quantity, right? You're not getting the quality of sleep that you need. You're going to feel it mentally, physically. Your body's going to be exhausted. Your mind's going to be tired. You start thinking about, why am I not getting the output at work, or why am I not getting the promotions that I feel like I should? I've been at the same job for so many years. Why am I not, having the results in school or in college that I should be having? I've been studying my tail off, right?
Yeah.
But it's maybe your mind's not in it. Maybe you're not able to focus and concentrate, and that's what these people.
Because if you don't sleep, you can't concentrate.
If you don't sleep, if you're not breathing, if you're constantly coming out of this deep sleep throughout the night, then you can't focus.
So you're in a unique position. So you fit people with these appliances that open up their airway when they sleep, and then you see them change as a person.
That's absolutely right. It's as simple as that. It's really a custom-made mouthpiece, okay, that they can comfortably wear in their mouth when they sleep. Just fits right over their teeth. Some people think that, or they predict, is it going to be obtrusive? Am I going to be able to talk? And the answer is absolutely. You can open and close your mouth. You can talk when you wear the device. You can drink water while it's in your mouth. You can sleep in any position, travel very easily with it. This isn't orthodontics. We're not moving teeth, and we're not permanently changing your look or your jaw or anything like that. It's just a temporary repositioning of the jaw and the tongue when you're sleeping, just a few millimeters, very comfortable.
Okay.
Just enough so that your airway opens and you can breathe.
So these people, they're breathing just fine throughout the day. Walking around, they breathe, then they lay down. So what's happening? They lay down and their jaw drops back?
Randy, it's just like we all think, right? When you sleep, what happens? Your whole body relaxes, right? So with the rest of your body, right? So does your upper airway. So all the tissues, the tongue being the largest muscle in the mouth, the jaw, everything relaxes. By the way, the tongue is attached to your lower jaw. So when your lower jaw relaxes when you sleep, that tongue falls back into your throat. It blocks the back of the throat. So physically, that's why we call it obstructive sleep apnea. It's obstructive. Physically, air cannot pass through that space, and you can't get air into your body. So they're just exhausted. When you don't get air, you don't get oxygen. And when you don't get oxygen, you're exhausted throughout the day. So physically, what we're doing is actually similar to what you might think of when we do CPR, right? We actually reposition the jaw very slightly, and that opens up the airway. Why? Because when the tongue's attached to your lower jaw, it brings the tongue forward. It allows the patients to breathe by opening up the airway. Okay, so it's a very unique and very simple approach.
And now you wear one.
Correct, yeah.
Is that right? I asked you in the green
Yeah. And you were surprised?
Now, CPAP, I misspoke earlier, and I said 60%. I guess the study is around 50% of the people can't wear CPAP. Now, CPAP works.
Absolutely.
Right? But I guess if half the people can't wear it, it doesn't work. You tried it, you said.
Yeah.
Randy,
you
were already wearing an appliance that worked.
Correct.
So why the CPAP? Why did you do it?
Well, I wanted to see what my patients experience, right? Because a majority of my patients that come in have been referred by their physicians and have tried CPAP. And I wanted to see what their experience was like, right? So I actually went ahead, paid for one, and ordered a CPAP myself, even though I didn't need it. Okay, but I wanted to see what their experience was like. I tried it on, and honestly, I was comfortable with it, but it was really...
Is it true you have to sleep on your back?
Yeah, absolutely.
Oh my goodness.
It's very difficult when you have a mask on your face and you have hoses and everything that need to be positioned a certain way.
So you didn't actually like it. I mean, you tolerated it, but you didn't like it.
I was able to tolerate it, Randy, because I knew I was only using it for a short period of time just to try out. But let me tell you, my wife couldn't stand the noise. Every now and then the air would leak from the mask, and it would actually go on her. Now, this is actually a really high power of air. Okay, so it's not something that you'd think from like a nasal cannula or something like that. I mean, this is a high force of air going through this mask into your mouth or your nose, and so when it leaks, it makes a lot of noise. Okay, so she was feeling it. The hose that comes off the mask and attaches to the machine is getting tangled around our bed or around her, and so she was having trouble with that. And then the biggest thing I didn't like, Randy, was that once I put that mask on, I couldn't talk. Okay, so if she asked me a question, I couldn't answer, and I was kind of stuck. I was like, you decide that at this point on, I'm done, lights off. We're not going to be talking anymore for the rest of the night. So that was the hardest thing I had to deal with, and then the maintenance of it, right? So it was
to clean it.
Yeah, absolutely. The 15, 20 minutes or more that it requires every morning to clean and maintain it. All the parts, you have the mask, the tubes, the filters, the humidifier tank, traveling with it, the costs associated with all that stuff. So it was really a convenience factor for me. I just found the oral device is so much simpler. I just put a mouthpiece in my mouth, I go to bed, you just brush it the next morning to clean it. There's a solution to disinfect it. You really don't have to worry about anything else. It's very simple for me.
Now, you are a diplomat of the Sleep Society.
Correct.
What is it?
It's the American Board of Dental Sleep Medicine. So it's actually a sister company of the American Academy of Sleep Physicians. So all the physicians that are board certified in sleep, and we're the sister company to them.
Now, you teach other doctors, other dentists on how to do this.
Yeah, actually, Randy, as a matter of fact, after our talk today, I'm actually going to be going to lecture for 2 days to a group of doctors and nurses on sleep medicine.
2 days, like
2 full days. Yeah, 8 hours a day. We're going to be
you're going to lecture
talking
for 16 hours.
Yeah.
Is there that much to this? I
Randy,
say that respectfully, but I mean, is there really that much to it? I mean, so obviously the device doesn't do all the work.
Correct. Randy, and we're just skimming the topic. When I say, you're asking me if there's more to it than just the 16 hours I'm lecturing. It took me 2.5 years to gain my board certification in dental sleep medicine. So this is a very in-depth topic. There's a lot to it. There's a lot of science and medicine behind it, but there's also a lot of other things, right? Like, billing your insurance company and making sure that patients are receiving the care that they need, making sure that we are adjusting these devices the right way. Are we choosing the right device for the patient? Because there's over 140 FDA-approved devices out there, oral devices, for them to wear.
Now, you brought 2. Are these your 2 favorite?
Yeah, absolutely. Well, these are 2, I would say 2 of the best quality of devices that are out there in the market. Yes, two of my favorite.
Okay, one smaller than the other.
Yeah, absolutely.
That looks like the good one.
Yeah, no, well, you know, they're both equally effective. They both do a great job. They have their pros and cons.
Let me see this. Let me see how small these things
Yeah,
are.
absolutely.
So this is
Look
nice.
at this.
I guess you could see this. I mean, this is really small.
Yeah. Now,
This seems comfortable,
yeah,
right?
absolutely.
And insurance covers it.
Absolutely.
Medicare covers it.
Now, Randy, the unique thing is that there are so many different devices out there in the market, okay? Over 140 FDA-approved oral devices. They all have their own strengths, different materials, different sizes, different comfort levels, right? And for different purposes. So I like to say that we should be able to find a device that suits almost anyone's need, right? And so that's what I love about these devices. There's so much to choose from. It's not like a one-size-fits-all. Okay, so patient may be receiving orthodontic care, for example, right? They're going through braces. Well, guess what? We can make a device for them. And as extreme of a case as an elderly patient, I've treated many who have dentures, a full set of dentures, upper and lower, and we can make an oral device, right? So there's so many options here that it's ridiculous.
And for many people, you say it's life-changing. Just getting them back to sleep and no more snoring.
Yeah, absolutely. Randy, can you imagine if somebody's life depended on this? And when I say life, I also mean livelihood. You know, I had a patient, Jimmy, okay, about 40, 45 years old, male, who came in because he had no other options, okay? He's a truck driver, so his livelihood literally depended on him receiving benefit for his sleep apnea. He was stopping breathing over 50 times an hour, so he had severe sleep apnea, okay? His oxygen levels are dropping below 70% during the night, okay? So very, very dangerous. By the way, when I'm in surgery, okay, and I'm at the surgery center, if my patient's oxygen level drops below 93, 94%, the anesthesiologist will step in and stop the procedure and make sure that the patient's breathing, okay? So that's how serious it is. Well, Jimmy comes in, and he had tried the CPAP machine, absolutely could not tolerate it. And him being on the road all the time, he also couldn't always take it with him, so that was another big challenge. But he needed something that really worked for him. His job, believe it or not, put a restriction and put him on leave and said, unless your sleep apnea is treated, you can't come back to work. Okay, so his doctors were monitoring his care.
So he was sleeping while he was driving. He was falling asleep.
Absolutely. Okay. Yeah, he was very tired, and their risk was their fear was that, you know, they didn't want him to get into a car accident, right, and die potentially. So he gets referred into my office. He comes in, and he's amazed. He had never heard of this treatment before. We explain him how this worked and what it involved, and in one afternoon, his life changed. Once he started using the oral device, he had a lot more energy. So immediately when he comes into his follow-up appointments, Randy, by the way, we have 2 or 3 follow-up appointments where we make sure that these devices are working.
Because you may have to adjust them.
Absolutely, yeah.
Okay.
We start them off very comfortably, and we want to make sure they're comfortable through the whole process. And we want to adjust them to the optimal position. So this is not about moving your jaw all the way forward or making you look, you know, like a monkey or like Jay Leno or anything like that.
Okay.
It's really about just a minimal adjustment to make it comfortable but effective, right? So he comes in for his follow-up appointments, and immediately he tells me how he's sleeping better, his snoring is a lot less. So his wife is telling him that, you know, she can even sleep through the night now, by the way, right? So even though he may be waking up, you know, 50 times a night, so is she, right?
All right.
So she's sleeping better, but he's getting more energy because he's sleeping better, okay? He immediately notices these results where he's not snoring as much, and he's not as fatigued during the day.
Back to work?
He's back to work. Well, we got him adjusted. We did a follow-up sleep study, okay, where we were testing to make sure that this device is actually working, it's effective, his oxygen levels are up. He went from 50 times an hour to just 7. Okay, so now
waking up. We're talking about
waking up. Yeah, he was waking up 50 times an hour.
It's hard to believe people will wake up 50 times an hour.
Can you imagine? Right? It's really, really amazing. I mean, at how much this can really affect their quality of life. But you know, now on another level, his blood pressure is down. Right? He's now even considering talking to his doctor about getting off of his blood pressure medications. So it's really a comprehensive and all-around turnaround in his life. He has more energy. He's a different person. He's a lot happier now. He can concentrate and focus when he's driving his truck, and he's not sleepy. So his doctor allowed him to go back to work. Okay, so he's back to work. Another really interesting thing about this specifically is that a lot of these jobs now require that these devices are effectively treating their patients with, you know, for their sleep apnea, and so we can even track and monitor that their patients are using this and submit that data to the insurance companies if they require it, to the doctors, that kind of thing. So it's really, these devices have evolved a lot. You know, they were actually They came out in the early 80s, almost the same time the CPAP mask did. And they've been around for a long time now. So these are a proven treatment option, one of the first line treatment options for sleep apnea and chronic snoring.
So talking about the snores for just a moment. So people with that really loud snores,
Sure.
right? I was on a school trip with one of my kids, and the guy had to sleep up top of the deck of the ship. So my question is, how well does it work for just the snore crowd?
Yeah.
And does every loud snorer have a little bit of apnea?
Sure. I had a patient who came in, Elaine, in her mid-30s, and she did not have sleep apnea. She had a sleep study done, no apnea, but she said she snored like a freight train, okay? She was so embarrassed. She kept holding and postponing trips with her girlfriends because she couldn't sleep in the same room with them. She was so embarrassed. Well, she had a trip coming up in about a month and a half, and she comes in and tells me, asks me if there's anything that we can do for her. So we were able to make her a very small oral device that was clear, that she loved, that nobody could tell she was wearing, and it completely got rid of her snoring. So even before she went on her trip, she told me, Dr. Shah, my boyfriend said I'm not snoring anymore, and I'm so excited to go on this trip. And of course, I never hear from these patients again because their problem solved. It's like, they're happy, and so they're off and away and living their life. So very, very pleased to have.
But it is mostly men.
It is mostly men. It affects more men than it does women.
So if somebody's watching this and their partner is a loud snorer, they need to drag them in and see.
Yeah, absolutely. And it's majority of our patients, I would say, were dragged in by their spouse.
Oh, is that right?
Yeah, because it's really, when you're the one snoring or you're the one not breathing at night, you don't even know that you're doing it, right? It's not like you're waking up or waking yourself up. It's your spouse. It's your wife or your husband looking at you saying, gosh, I'm scared. He's not breathing. Or gosh, he's making so much noise. I can't sleep next to him. And it's affecting the relationship.
So you get referrals every day from medical doctors?
Absolutely.
Every day in your office?
Absolutely. And
so the word's on the street then that this is effective?
Yes, that's absolutely true. Yeah.
Okay.
And it's also that how well we screen and we determine who's a good candidate for this treatment. Because let me tell you, this isn't for everybody, okay? So I'm very, very selective at who I feel is a good candidate for this treatment. That's what our initial exam, our 1 hour where we first meet the patient, is all about. We do a comprehensive exam. I review their sleep study with them if they have one. And I want to make sure that this is, what are your chances of success? This is actually going to work for you.
So are the appliances getting smaller and smaller? Because I've had people on the show talking about this years ago, and the appliances seem very big.
Yeah.
These seem very small.
Yeah, absolutely. And they're so great now that they're even 3D printed. So we can make a device.
That little one right there is 3D printed.
Absolutely. Yeah, where we can actually scan in models of your teeth, okay, and a printer will 3D print the device, where this is the lightest and thinnest device out in the market.
We're short
today.
on time, but your mother had sleep apnea.
Yeah.
And you took care of it?
Yeah, that's absolutely right. And the funny thing is her doctor did not feel it was necessary to test her for sleep apnea. It was a very difficult time in my family's life because my mom had just had a heart attack. And so it was actually in a meeting with her cardiologist where I really pressed for a sleep study. And he absolutely didn't feel like it was necessary because if you look at my mom, she's not the typical sleep apnea patient. She's very, very petite. She walks miles every day as exercise with my father. And she's vegetarian, she's very good lifestyle. And so her cardiologist did not feel like she was going to have sleep apnea. So her cardiologist finally agreed to give her a sleep study. Guess what? She had severe sleep apnea. She stopped breathing 33 times an hour. Her oxygen levels dropped into the low 80s, okay? So I was very scared, and immediately I wanted to make sure that she was treated, okay? So now, me being the son and me knowing about this, I want to make sure she got the best treatment.
Yeah.
And so we got her a CPAP machine. That's what her doctor recommended first, so we went ahead with that. And she just could not tolerate it. She felt so claustrophobic with that mask. She could not sleep with it. And here I am and my father, and we're really pushing her to try it night after night. And she called me one day and she was just crying on the phone. She did not want to use it. She couldn't use it anymore, and she was just fed up. And she said, "Why don't you just give me the mouthpiece that you give to all of your patients?" Right?
Yeah.
So we made her a custom oral device. Guess what? It completely got rid of her apnea. She went from 33 times an hour to only one event every hour where she woke up, okay? So completely got rid of her apnea. I got a call from her cardiologist the day after her sleep study, and he was chuckling on the phone, like, I should have believed you, and I'm sorry, but he was a very nice guy. But it worked out great for her. She's able to tolerate it. And the another big thing is another side effect, positive side effect impact that it had on her was that she grinds like anything, okay? She grinds so heavily, bruxing is what we call it as dentists, where she has worn through almost all of her teeth.
So
now,
this stopped that?
So it completely stopped that as well. So it's really knocking out two birds with one
And her
stone.
energy level, I mean, you know, because these stories that you're telling where they're, you know, they have more energy, more focus.
It absolutely
That'll
changed her
happen.
life, absolutely. She's sleeping better, she's not snoring anymore. My father said that my mom's a different person now, okay? She has a lot more energy, she's a lot more lively. She has a more positive outlook on life, okay? So it completely changed her life.
Now, medical doctors will watch this show, and you work with the medical doctors, and I guess like with your mother, you don't go out of your way to contradict their advice.
Absolutely.
Okay.
Yeah. You know, I think one of the biggest advantages and focuses of my practice is that I want to work with our medical community, right? And we do, very, very integrated with them. The fact that we are focused on this treatment and nothing else. I don't do any general dentistry, no drilling and fillings. When you come to my office, you won't hear any noises, right? But that gives me a chance to spend the time and care that I feel like we need to make sure that our patients are treated successfully. That allows me to make sure the devices are adjusted successfully, that we can communicate with these doctors and make sure that they receive information on the care while it's going on and after it's completed, and that once the devices are successfully adjusted, that we do a follow-up sleep study. We make sure that it's actually effective so patients are breathing better, their oxygen levels are better. You know, I don't want this to be a guessing game. This isn't about just throwing a piece of plastic into somebody's mouth. Really, it's about making a custom-made device that can be very, very effective.
We are out of time, but
Sure.
as mentioned, Medicare covers this, medical insurance covers this. Do you need a referral from your primary care physician to see you?
Sure. You know, I prefer they do, but it's not necessary. A lot of times we can communicate with the doctors
So
directly.
they can call you first?
Absolutely, they can, yeah.
Okay, good. I want to thank you for coming to the show. Great information. If somebody wants to know more, they could go to your website, make an appointment, and you have a couple of offices, I guess.
Yeah, you know, just by necessity, doctors have asked us to be close to them so they can refer us their patients. So we now have 5 offices in the Bay Area. Our main office is in San Jose, but we have locations in San Ramon, in Los Gatos, and in Santa Cruz. So we'd like to think that we're in an office close to you.
Okay, good. I want to thank you so much. You're going to wipe out sleep apnea in that area?
We hope to make a dent.
Okay, good. Thanks again.
Thank you so much.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.